Good evening, dear viewers, dear friends from the press. Please allow me to brief you on the latest development of COVID-19 containment in Zhengzhou. First of all, the latest numbers.
截止8月8日18时，我市新增本土确诊病例1例，原无症状感染者转确诊40例，新增无症状感染者1例。自7月30日以来，我市累计报告本土确诊病例81例。无症状感染者44例，均按要求实施集中治疗或隔离医学观察。集中救治情况，
situation of treatment according to the requirement. The first Renmin Hospital and the Harbor Hospital has been renovated and have been proved to be the specialized hospital to admit the infected patients.
省人民医院、省中医医辅院、郑州人民医院收治的境外输入患者
as well as the imported cases.
转运至
In all of these cases, domestic cases and imported one has been transported to this specialized hospital, and currently it is attended by the special medical team. And altogether, it is now attending 106 patients, among which and 81 asymptomatic patients. And 16 are kept in medical observation. Third, the nucleic acid test situation. Up to August the 8th, 16 o'clock, we have taken more than 62.8 million samples in the third round of COVID-19 test. And 360,000 cases have been tested, and one abnormal case is sequenced. In the third round of test, we will be prioritizing and carry out targeted tests and processes in order to ensure better quality, and we will standardize and strengthen the organization at the sampling site, streamline the process, and so as to open up the data and make sure that the sampling, testing, transportation, input, and result searching are integrated and efficient. Fourth, the party members and cadres are participating actively in this process. According to the local government's requirement and the requirement of the administration of the government, the party members are playing an important role and have organized more than 29 party organizations to form 31 temporary party groups, 97 party groups to work in 27 highway checkpoints, and altogether 8,000 party members have been deployed to these checkpoints to carry out this traffic control work. Multiple measures and problems have been implemented and addressed. At the same time, we are also going all out to provide the best service possible, and that's all for my brief today. Now the floor is open to questions. You're free to raise your questions and make sure to identify yourself before asking the question.
谢谢主持人，我是经济日报记者。我们关注到8月7日，郑州齐柏山医院患者已全部转至郑州市第一人民医院港区医院。请问，作为新的新冠肺炎定点医院，港区医院现在的病房改建及收治情况？
这个问题，请郑州市第一人民医院港区医院院长刘玲来回答。
我向大家介绍一下，郑州市第一人民医院南院区位于郑州航空港经济综合实验区遵大路南段、遵大路中段，占地294亩，规划床位1600张，一期设置床位800张。8月5日，根据郑州市疫情防控指挥部部署和国务院联防联控工作组专家建议，将我院南院区改建为新冠肺炎救治定点医院。8月6日，改造完工。病人，本次改造涉及2栋病房楼，共16个病区，含2个重症单元，共308个房间，最多可以开设床位664张。 含重症床位48张。截止8月8日12时，我院收治患者203人，现无重症患者。医疗护理、医技等人员来自郑大一附院和郑州市第一人民医院、河南省中医学院一附院，并有国家级。
We have also experts that comes from the city level, provincial level, as well as hospital-acquired infection and pulmonary department. And all the patients are given an individualized treatment plan. Currently, the situation of all the patients are getting better. Next question, please. With the China News Agency, according to the current status quo, the leading group have closed down some of the key areas. So how many mid-risk areas are there in Zhengzhou district, and how are the controlling measures going on there? Friends from the press, good evening. Currently in Zhengzhou district, there are 6 mid-risk areas: the Yanzhuang Square, construction site for subway line 6, and Yuxingyuan living quarter, and Pulo living quarter, and Kaiyuan living quarter, and altogether more than 7,500 households have been kept indoors for quarantine. And all of these living quarters residents need to scan the health code in order to get in and out. And we also use broadcast and WeChat group as well as the WeChat account to notify the residents on the latest information. We have also carried out daily supervision and report in these key areas. In some key locations, we also make sure that the farm markets, the supermarket, and drugstores that provides daily necessities for the residents are operating as usual. Currently, the 591 drugstores in our district have stopped selling this kind of fever drugs for fever and high temperature. And, we also have suspended some of the businesses that have disobeyed the control measures and containment measures. And all of the enclosed areas needs this QR health code scanning if you want to get in. The party organizations at different levels have played an important part in this process, and altogether more than 170 cadres are working at a grassroots level and have organized temporary party organizations, and they're working with the community workers, the policemen, the doctors and nurses, and all kinds of volunteers and party organizations to ensure that the community disease prevention control went on in a smooth manner. And all the enclosed areas, the residents' QR code shows a red color, and they will have to undergo 5 nucleic acid tests in this quarantine time. And we have also set up checkpoints and barricade to make sure that this place is perfectly kept quarantined. We also have organized and implemented different digital technologies to make sure that the people are kept quarantined. Once the patients show symptoms of fever and runny nose, sore throat, and so on, they can receive diagnosis and treatment firsthand in order to make sure that the residents have sufficient supply. On a daily basis, the community workers will help them to buy groceries and with the garbage discharges, especially after this heavy rainfall that we went through, in order to make sure the power supply and water supply and telecom connection of the enclosed area. We have also done some special work to ensure that. We have also strengthened the sanitation and disinfection in this quarantine area so as to make sure that no secondary pollution happened in this time. We send out notifications to the residents through different platforms, including the WeChat account and WeChat groups, so that to make sure that our residents cooperate and understand our control measures. And we also give special care to the elderly and the young. Next question, please. With Henan TV, my question is, since this outbreak, the city of Zhengzhou has carried out 3 rounds of tests. So can you tell us the latest progress of the test and what is your plan of the next round of nucleic acid test? So we'll give the floor to Ms. Li. Thank you for the question. I know that the residents are very concerned with the COVID tests, and I would like to take this question. So first of all, we have already finished the second round of comprehensive nucleic acid test, and the third round started in 27and Jinshui and Guangcheng, Mid and high-risk areas, and they have already started the third round of nucleic acid test. And the comprehensive third round of test starts today and it will expect to end tomorrow. And altogether, more than 10 million staff have been enrolled and involved in this process. The key population are the ones that have been to the 6th hospital, as well as the elderly and the young children. And we'll make sure that this process goes on smoothly. And coming up, we will be making our next plan of the next step according to the results of the third round of nucleic test. So our ultimate goal is to ensure the health and security of all the local residents. 我大和 newspaper. During the containment of COVID-19, one of the important work is medical transportation, and it has to do with people's well-being and health. So can you tell us more about this part? We'll give this question to Mr. Qiao from the Medical and Rescue Center. Thank you very much for your question and interest in our work. In our city, we attach great importance to the medical transfer and transportation during this epidemic. We have organized possible medical resources and human resources to form a special working group, and we have strengthened training and established a team of disinfection. We have set up this commanding center at the site in order to coordinate the transportation, the medical transportation. Since the outbreak, we have deployed 343 vehicles and have deployed more than 900 medical professionals. And we have transferred more than 1,400 patients altogether. And besides, we also strengthened the protection for the transportation personnel to make sure safe and high-efficient transportation and a smooth connection with the medical services of the patients. We are confident and determined and capable to fight and win this war. Thank you, Director Qiao. Due to time limit, that's all for today's Q&A session. If you have further questions, you can send your questions through our email.
在这里，我们要感谢关心、关注和支持郑州新冠肺炎疫情防控工作的媒体和媒体记者朋友们。我们看到，每一次疫情防控通报，每一次疫情防控的发布会，媒体都在第一时间发布，以市民喜闻乐见的方式传播。这些用心、精心和细心，我们都记在心里。我们看到，媒体对郑州新冠疫情防控的加油和鼓劲儿，为我们凝聚力量，彻底打赢这场疫情防控战，营造良好的氛围。向大家说一声谢谢，辛苦了。今天的发布会到此结束，谢谢各位发布人，谢谢各位媒体界的朋友们。